Let's discuss the topic called Ascariasis. Ascariasis is a disease or an infection that is caused in the small intestine of the humans. So it is caused by the roundworm called Ascaris lumbricoides. So these roundworms are a type of parasitic worms. And also this infection caused by these roundworms are common in our country. Ascariasis is most common in places without sanitization, so that the people got this parasite through the unsafe or unhygiene food and water. So this infection usually causes no symptoms, but if a high number of roundworms will be leading to the problems in the lungs and the intestines. So what causes an Ascariasis infection? So normally you will become infected with Ascariasis after accidentally ingesting the eggs of the Ascaris lumbricoides roundworms. These eggs can be found in the soil that will be contaminated with the human feces or uncooked food that is contaminated by the soil that will carry the eggs of these roundworms. So mostly the children will be affected when they put their hands in their mouth and playing in contaminated soil. The common symptoms of the Ascariasis will be coughing, wheezing, shortness of breath, aspiration pneumonia, blood in mucus, chest discomfort and fevers. So the roundworm that is present in your intestine that can cause nausea, vomiting, irregular stools or diarrhea, intestinal blockage, loss of appetite, abdominal discomfort, weight loss, etc. Life cycle of the roundworm. So after the ingestion, the Ascaris lumbricoides roundworm reproduce in our intestine. So it will be having a life cycle. We will see the life cycle of roundworm. So the swallowed egg first hatch in the intestine itself, in the host called human. Then later the larvae then move through the bloodstream directly to your lungs. After the maturation, these roundworms will leave the lungs and travel to your throat. So either cough up or swallow the roundworms in your throat. Later, the worms that are swallowed will travel back to your intestine again. Once they are back in your intestine, they will again mate with them each other and they will lay more eggs. So this cycle will continue and some of the egg will be released through our fecus. So what are the precautions you should take to avoid this Ascariasis? So we should be always hygiene and wash our hands with the soap before and after preparation of the food. We should boil or filter our water that we are going to drink. We have to inspect or check the food preparation facilities. We should avoid unclean common areas for the bathing. Unwashed vegetables and fruits in region that is not having any kind of sanitation should be avoided. So commonly children which will be under the age of 8 are most likely to infect the diseases because they will be playing in the soils. What are the complications of Ascariasis? So generally the Ascariasis will cause the intestinal blockage. So whenever the medical emergency is there, we should take the treatment right away. Next will be duct blockage, nutritional deficiency. So we can diagnose this Ascariasis by X-ray scan, CT scan, ultrasound scan, MRI scan and endoscopy. So endoscopy is the process in which we will be using a small camera to view inside your body. So how is Ascariasis treated? So normally the medications like albendazole, ivermectin and mebendazole will be given.